whether it's from a car accident, a strong emotional shock, or some sort of illness. Coma is not an easy condition. A coma is a state of unconsciousness where a person is unresponsive and cannot be woken. The coma itself occurs after a severe head injury or stroke, though it can be a result of severe poisoning or a brain infection. A person in a coma has minimal brain activity. They won't normally respond to sound or pain, or be able to communicate or move voluntarily, and basic reflexes, such as coughing and swallowing, will be greatly reduced. Most comas do not last for more than 2 to 4 weeks. Some people may recover from these states gradually, while others may not improve for years, if at all.
After a while, comatose person may start to gradually wake up and gain consciousness, or progress into a different state of unconsciousness, called a vegetative state or minimally conscious state. A vegetative state, where a person is awake but shows no signs of being aware of their surroundings or themselves. Whereas a minimally conscious state is where a person has limited awareness that comes and goes. After the acute period in emergency and intensive care, treatments for these patients are not particularly high-tech. Keeping them alive requires good basic care, such as turning and changing position to manage skin integrity, a feeding tube, intermittent antibiotics for infections, and perhaps some ongoing mechanical ventilation support, such as oxygen at night.
If someone is in a coma for a long duration, there are numerous methods available for feeding. Electrolytes, which are essential to healthy heart and muscle function, can be provided through an intravenous route. There are also 4 fluids known as banana bags that contain essential vitamins and minerals.
For those needing more regular feeding, or if a doctor decides other options need to be considered, a gastrostomy tube can be inserted through the peritoneal and into the stomach, and the patient can be fed this way. The fluid often looks similar to runny oatmeal and can be fine-tuned to the patient's required intake.
Sometimes people who come out of comas are just as they were before. They can remember what happened to them before the coma and can do everything they used to do.
Other people may need therapy to relearn basic things, like tying their shoes, eating with a fork or spoon, or learning to walk all over again. They also may have problems with speaking or remembering things.
Aruna Shanbog died with pneumonia in May 2015, after 42 years in a vegetative state. She was 25 years old when in 1973, she was raped and strangled, leaving her with severe brain damage.
Her survival for so long is a testimony to the dedicated care provided for her by generations of nurses at the hospital in Mumbai where she had worked.
The question here is, should we routinely deliver life-prolonging treatments over years to people who have no realistic chance of ever regaining consciousness?
New medical technologies mean that increasingly people are able to survive devastating brain injuries caused by accidents, assaults, falls, strokes, or infections. A proportion of these patients will pass through a short-term comatose state to recover full consciousness or at least some level of awareness. However, others will be left in a permanent vegetative state. They are not brain dead, they have a functioning brainstem and can usually breathe on their own, but they have no awareness of themselves or their environment. And the longer they remain unconscious, the less likely it is that they will ever become conscious again.
In the English law, and according to Mental Capacity Act 2005, states that treatment should only be given if it is in the best interests of the patient. In some cases, it may be that the family believe that the patient would have wanted ongoing treatment regardless of their level of consciousness or prognosis. Alternatively, some family members may be hoping for a miracle recovery, or are simply not yet ready to let go of a loved one.
Treatment for coma depends on the cause. People close to the comatose patient should give doctors as much information as possible to help the doctors determine the cause of coma.